So HIPAA, everybody thinks of HIPAA from hospitals, right? We all think if we go to the hospital and we sign this form and it says it's HIPAA, and how many of us really know what it means? Has anybody ever really read the form? Or like most of us, we skim over it, we look at a couple sentences, okay, sign it, give it to the doctor or the assistant, and off we go, right? But it's been around a long time, okay? HIPAA's been around for 20 plus years now is when it first started. It's probably the one that's been there the most, but there's some areas where there's a lot of people that don't understand that HIPAA isn't just the healthcare and the pharmaceutical and the hospitals and clinics, but dentist optometrists also have to meet HIPAA, which you're probably seeing. But a big one that we find that are getting issues with compliancy are like fitness centers. Because you fill out a health thing before you sign up for a fitness center that says, I'm okay to exercise here, right? Or coaches or trainers at schools, high schools, universities, club events, your kids, whatever. Okay, are they storing that information properly? Do they know who has access and who doesn't have access to it? So there's all those different areas that go within the HIPAA type of organization. What does it mean to the data center? The biggest one is production plus disaster recovery. Because here's the reality. That medical data that is really HIPAA data, if a hospital's data center goes down today and they can't access that information, someone could die, right? It's a life or no life type of instance, okay? So it's very critical that from a facility standpoint, we have a secondary facility. Now, it could be in the cloud with the provider. It could be an owned facility. It could be an external co-location. It could be that you're just replicating data. There's a whole bunch of different things that go there. But from our side, we need to make sure that we've got a secondary site, okay? We need to make sure, again, unauthorized access, okay? And how many of you keep maintenance logs on all repairs and things that happen within the data center? A lot of us have any maintenance logs, okay? Those are critical when it comes down to repairs and modifications of the facility. If the facility fails, and hopefully not, but if something happens and somebody does die or get seriously injured because we don't have the redundancy under the HIPAA requirements for access to that information, that we've at least documented everything that's happened along the way of how we're keeping that facility up when we're doing repairs or other things, right? That's why also the majority of facilities within the healthcare or this industry should be an Uptime Institute Tier 3 type of level, right? Concurrently maintainable, so that you can get in there and you can support that. On the other side, this is really more of training that goes to the end users on the HIPAA, more than any, okay? Because people that are taking your credit card transactions, it's not the person standing behind the cash register. You're putting the card in, the card's sending the information. They're not touching it, right? Okay? But when you're talking about medical people, you have nurses, you have assistants, you have just a whole realm from the doctors all the way on down, from the pharmacists already down to somebody in the drugstore that might just be assisting at that point in time that are handling this information. So training about the information from the operations side and the IT side is very important around HIPAA. It's one area they're going to look at. Do you have things within your employee handbook related to understanding of HIPAA information if you're in any of those fields? Again, there's a whole list with HIPAA. HIPAA is actually probably, I'm going to say, it's obviously the most mature, so it's probably the most easiest of those to do a compliancy review with, right? Because it's been out there a long time. There's very specific things that it has, and people are aware of it and where it's at. But again, you're going to see the same things. Risk analysis, you're going to see security awareness, you're going to see training, you're going to see contracts that talk about it, disposal of the information, when do you dispose it, how do you dispose of it, this is a big one right here. Maintain a record of movements of hardware and electronic media and the person responsible. So from the IT perspective, if you're replacing desktops or laptops or workstations or tablets that the doctors might be using or any of that type of equipment, it becomes critical that you maintain and track where that is and that it's properly disposed of and that it meets some of the disposal criteria. Because that data could be on any of those devices. As much as we like to think it's in the data center, a lot of times it's not. It could be anywhere within those.